Hi, in this video we'll talk about low birth weight. Babies born with a birth weight of less than 2.5 kgs irrespective of their gestational age are termed as low birth weight babies. It is an important determinant of its chances of survival, health, growth and development. Low birth weight can contribute to developmental delay, growth retardation or improper health, congenital anomalies, etc. In fact, mortality rate is higher in the babies of low birth weight. So we'll classify the babies under two conditions. One is birth weight, another is gestational age. So according to the birth weight, moderately to low birth weight is under the category of 2.5 to 1.5 kilograms, very low birth weight 1.5 to 1 kilogram, extremely low birth weight when the baby is less than 1 kg. So according to the gestational age, the babies are called preterm if they are born before 37 weeks of gestational age, and term if they are born between 37 to 42 weeks, post-term if they are born after 42 weeks of gestational age. So coming to low birth weight, the causes of low birth weight are two things. One is preterm babies, another is small for date babies. So who are preterm babies? Just now we said preterm are the one who born before 37 weeks of gestational age, right? So the babies born alive before 37 weeks are called as preterm babies. So these preterm babies again can be categorized under three things. One is extremely preterm, very low preterm, moderately low preterm babies. So extremely preterm babies are less than 28 weeks of gestational age. Very low preterm babies are 28 to 32 weeks. Moderately low preterm babies are 32 to 37 weeks. Types of preterm babies. How the babies are born before the gestational age of 37 weeks. One, it can be because of spontaneous delivery, like spontaneous onset of labor. It can be due to premature rupture of the membranes, such things spontaneously. There is natural delivery. If the induction of labor is done before 37 weeks of gestational age, is called as provider-induced preterm. It can be done in cases of elective cesarean section deliveries, etc. or emergencies, etc. So this we are going to write under preterm babies. One, we'll write the definition. That means the babies born before 37 weeks of gestational age are termed as preterm baby. And second, the types of preterm babies. One is extremely preterm, very low preterm, moderately low preterm. 28, 28 to 32, 32 to 37. So types of preterm, one is due to natural delivery, that means spontaneously preterm, rupture of membranes, spontaneous onset of labor. And second, provider induced preterm, that means the doctor or the gynecologist will induce the labor in her before the 37 weeks of pregnancy because of emergencies or elective C-sections, etc. To small for date babies, small for gestational age babies, term babies or post-term babies, the weight is less than 10th percentile of the gestational age. Baby, the small for date baby, is 10 percentile less weight compared to other babies who are born in the same gestational age. Weight is less than 10th percentile of the gestational age. The baby can be term or the post-term, whereas here the preterm babies, the baby is before 37 weeks. Here in case of small for date, the baby is term or post-term. Term means, again we have seen here, right? Term means 37 to 42 weeks, post-term is greater than 42 weeks. Here, because of the low weight, you can also see this retarded intrauterine fetal growth. So the factors associated for this intrauterine growth retardation are maternal factors, placental factors, fetal factors. The placental factors are placental abnormalities like placenta previa, placenta abruption, etc. Fetal factors can be congenital anomalies, chromosomal abnormalities, infections, congenital anomalies, fetal anomalies. These are the fetal factors which are responsible for intrauterine growth retardation. Now coming to the maternal factors, the mother can be malnourished. She can have severe anemia or hypertension or infections like malaria, heavy physical work, and she can be short, maternal stature and very engaged, and also associated features like smoking, alcohol consumption also contributes to this maternal factors which results in intrauterine growth retardation of the baby. So these are the things. So what are the things you're going to write under small for date babies? They are small for the gestational age. That means the babies who are born with the same gestational age are comparatively doing better than these babies. So their weight is less than 10th percentile of the gestational age. That is the first point. And second thing, they can be term or post-term. Whereas in the preterm, the babies are less than 37 weeks. Here, the babies can be 37 to 42 weeks or above. And third point you're going to write is retarded intrauterine fetal growth. And then we're going to write the factors associated with this: maternal, placental and the fetal. So the small for date babies are high risk of neonatal and the infant mortality. So infant mortality rate is 20 times higher for the low birth weight babies, and prenatal deaths are also common in the low birth weight babies. So what are the problems faced by these low birth weight babies? One, who are born preterm, and another who are small for gestational date. Coming to preterm, they can face this hypothermia, hyperbilirubinemia, apnea, hyaline membrane disease, intracranial hemorrhage. Now coming to the small for date delivery babies, small for gestational age babies. They can face hypoglycemia, hypocalcemia, polycythemia, asphyxia, pulmonary hemorrhage, congenital anomalies, right? What can be the cause of death in low birth weight babies? It can be pulmonary hemorrhage, intracranial bleeding, pneumonia, or malformation. So prevention and control of the slow birth weight babies by direct intervention or indirect intervention. First, let us see about indirect intervention. We can prevent early marriages, early childbirth, so that the mother will not be malnourished, she won't be having anemia, she can take care of the children better. And we can limit the family size, any other health conditions, and will promote adequate spacing between child to child, and improve maternal health services and the social status of the female. Direct intervention. First, the main problem here is low birth weight. Increase the food intake of the mother and also baby. Folic acid tablets to the mother and will increase the food intake in her, and also will increase supplementary feeding. Right. Now coming to other point, we also control infections like urinary tract infections, cytomegalovirus infections, malaria, rubella, syphilis, toxoplasmosis, etc. So early detection and treatment of this hypertension, diabetes mellitus, toxicemia, these conditions also helps in prevention and control of low birth weight in babies, as we have seen, right? So this hypertension is a maternal factor which can result in low birth weight. So that's why we can detect it early and treat it, and proper treatment will prevent this. And sixth one, what do you do for the child? How do you treat the low birth weight child? Baby is less than 2 kilograms, will place the baby in the NICU. If the baby is 2 to 2.5 kilograms, then we'll shift the baby to ICU for 1 or 2 days. And the infections and also nasal catheter is used for feeding. And another point which is very important, that it is essential for ensuring the best care option for the low birth weight babies is kangaroo mother care. Baby is placed on the mother's chest where the skin to skin touch. It ensures the bonding with the mother. It also helps in hypothermia and the breastfeeding to the baby. So this is about low birth weight babies. Bye.